Hi, Julie. I'm Lisa.
Nice to meet you, Lisa. I am just going to start off with asking you a couple questions just to get started, okay?
That sounds good.
Alright. Alright, so first off, I was looking at your medical screening forms and seeing that you came in with some low back pain.
Yes.
Can you describe sort of how long that's been going on for and when you first noticed it?
Okay. I've probably had some dull back pain since about 2017. And I noticed it mostly when I stay in one place for too long, and probably the worst pain that I have is like when I'm down on the floor. Let's say where I really noticed it was when at Christmas time when I was wrapping gifts. I'd be on the floor and just kind of sit down wrapping gifts, and I would almost have to like push myself up after a while. I could just feel like a dull ache and almost like, I don't know, it was becoming kind of stiff in that area. It wasn't responsible, so then I would just sort of go, have to like grasp onto something and just be like, okay.
Gotcha.
Not that I was in any severe pain, but it just took me a lot longer to get up and down. And then like this past year, so that was like 2017, I actually had an MRI done and I got the paperwork for it. I was interested in looking at it. But just this past year, I started for Christmas like wrapping my gifts on a table, so I'm trying to almost avoid bending over and staying in the same position for very long.
Gotcha. Okay. And then, okay, so and that's pretty much mitigated the worst bouts by altering. Okay, gotcha. Good. All right. And whenever you were feeling that stiffness, was it across your entire lower back? Was it specific to a certain point or side?
I would say for the most part it is across most of my lower back.
Gotcha. And would you say when you're looking across your lower back, it's evenly as bad, or is there one side that feels a little bit more bad?
It's evenly.
Okay. And so whenever you first noticed this, did anything particularly happen, like any car accidents, any falls, or anything?
Not that I know of. That's a good question. I thought that too. I think it's just age. I'm getting older.
Alright, and then, alright, so just sitting here right now, if a scale of 0 to 10, 10 being I have to go to the hospital, 0 being feeling nothing at all, what do you feel right now?
I would probably be a 1 or a 2 right now, but then I would say, like, if you had me sit here for another 15, 20 minutes, I would have to be like, I need to get up. I need to stand up. You know what I mean? I can't sit for very long periods of time.
Right, okay.
I feel better standing.
Would you like to stand right now?
I'm okay right now.
Okay, you can absolutely
But
stand.
yeah, but I definitely will stand up or whatever, move around too. I don't know, it's like, so it doesn't get too stiff, if that makes sense.
Gotcha. And so, whenever, if you would get to that point, getting to the worst you could ever feel, what would that be on that same scale?
I would probably rate it like a 7.
Do you ever get down to the 0?
Nope, I don't think I do.
Right. And then so thinking sort of throughout your day, is it particularly worse in the morning, the evening, afternoon, anything like
That's
that?
a good question. It probably is. It gets worse as the day goes on.
Okay.
For sure. So.
Right. And what does a day for you typically look like? Are you working, exercising?
I stay at home, but I do exercise a lot, and I'm up and down a lot. So yeah, I could never have a job and just sit at a desk all day. But right now I'm at home with my real estate license, and just so like I'll work on it for a little bit, then I've got to get up and maybe go wash dishes or do laundry or whatever. But I do I try to exercise at least 5 days a week, and that does help. So I do a lot of strength training, a lot of deadlifts. I try to hit my back at least once or twice a week, and that does seem to help. And then I do a lot of walking.
And how does it feel when you do those things? You said that they overall tend to help with like something like a deadlift. Do you ever feel those flare-ups, or
If I do a deadlift, honestly, it helps. It almost like, I think when I'm stretching and pulling up, it loosens it up a little bit. If I don't exercise my back, I think it stiffens. So, but now, who knows if I'm doing the right exercises. Deadlifts are just anything that I've just done for years. I think it was my original doctor that told me to do that like back in 2017.
deadlifts are overall pretty good, and it's good that it helps relieve some pain. So we'll definitely give you some exercises. All right. And just looking at some of the forms that you filled out, it looks like you are doing pretty well with figuring out the things that you need to do to sort of lower pain.
Yeah.
Whenever you are having some of that pain, do you ever feel kind of worried about it? Does it ever like
I
increase
don't think
anxiety?
I know. I don't think so. I think I've just sort of learned to live with it. That is one thing I've done. I feel like I just sort of live with a dull pain, but it's livable. It's there. It's not sharp or anything like that, but I will say too, like I was telling you that maybe when I get down on the ground wrapping gifts, or let's say there were kids lined up and there was like 10 kids lined up, and I was told I needed to go and like tie their shoes and go along like this. I would have to probably be like, okay, I need to stop for a second and then tie their shoes.
Gotcha. So by a few, it's good to get that step.
Yes, yeah, for sure. And then sometimes at the end of the day when I get in bed, and my husband and I have talked about like, is our mattress too soft, too hard, or whatever, I can't lay completely flat and I can feel the dull ache by the end of the day. So like, definitely like your first thing before when you said, you know, does it hurt mostly in the morning or at night or whatever, by the end of the day, as I'm picking up and lifting and doing all sorts of stuff, I can definitely feel a difference.
You mentioning going to bed. Is there a sleeping position that feels the most comfortable versus
On my side. Yes, I don't sleep on my back.
Okay. And which side?
I probably sleep on my right side and I do my left side.
And is that just preference, or does your left side hurt off?
It's just preference.
Right. Okay. And then, do you ever get pain that wakes you up from sleeping, or? I didn't see any particular medications that you've been on. Is that true?
Yeah. No medications.
All right. And I kind of mentioned it earlier, but you said you haven't been in any car accidents since the start of your pain or anything like that? And any surgeries? All right. And you kind of alluded to, you said you live with your husband?
Yep.
Awesome. And then, how many floors are in your house?
We have 3 floors.
Right. And then which floors are good?
It's like third floor.
How's going upstairs for you? You said the pain.
I go slow. And I use the railing for sure. Not slow, but slower than I used to. For sure. I definitely use the railing.
And which feels better and worse, going up or going downstairs?
We're both about the same, I would say. That's a good question. I'm definitely much more careful than I used to be.
Gotcha. Active, and then I'm assuming you drive yourself?
Yes.
Do you have any particular goals other than sort of lowering some pain?
No, I think it'd be awesome.
So we're gonna do some walking again. I'm gonna have you hold on to my fingers, and you're gonna just tippy toe.
And then,
Okay.
and then
Tiptoe
said it's a dull aching across your entire low back. Does it ever move anywhere else?
No.
Awesome. Okay. Let's go back to the table.
Do you ever get any numbness or tingling sort of like in your legs or your feet?
Okay, that's a really good question.
Get into more,
I mentioned that I'll do the deadlifts and stuff to take away the pain. Part of the reason why I went to the doctor in 2017 was because my lower back was hurting, but it was also affecting the left side of my body. I can feel indefinite weakness, and still can, but it's not nearly as bad on my entire left side of my body.
Like including your arms as well?
Yes. So they suspected back then that I had like a pinched nerve or whatever in my back. But it turned out it wasn't. A lot of it, I think, was just the whole thing does. It's been I do exercises to make it to dull it, but I could just be standing. I just know that like, even though I can like lift weights, like, it's hard to explain, but like I can feel a definite more weakness on this side of the body than I do on the right side.
Okay, so sort of all the time, the left side
Yes, all
entirely
the time.
feels like head to toe.
Yes. Yep. Is that weird?
Well, we're just gonna take a look at it today. It's not, you know, it's good to know.
I mean, it's something that I just kind of, I don't want to say ignore, but because I didn't, when I went to the doctor in 2017, they were like, it's nothing to really worry about, it's just part of it. Okay, amazing.
So good reading. I got 120.
And that was since 2017. It
Yeah.
wasn't before that. Did it ever go away, or has it always been here?
It's better when I
We're
exercise.
going to look back.
And then, aside from the feeling of generalized weakness across the entire left side, do you ever get like prickly feelings in your
No.
feet or anything? No. Awesome. Well, thank you very much. I think we're gonna go ahead and get a closer look.
Okay.
Hello, my name is David Clark, and I'll be your student physical therapist today. So after the subjective exam, we're going to do a little bit of an objective exam.
Okay.
So I'm going to have you do some walking and standing and some
Okay.
functional tasks.
Okay.
And I want you to just let us know if any of this reproduces that pain in the low back or
Okay.
any sort of like numbness or tingling.
Yep.
So first, I'll just have you stand up. I'm just going to feel your shoulders and hips and your back. That's okay.
Yep.
Any pain with that?
No.
And then step up to the
Now we're gonna do some shopping. So I'm gonna stand up on you. Hop on your foot.
Any pain?
On my flat.
Any pain with that?
No.
If I push there?
No, sir.
You mind if I lift your
No, I don't mind.
sweatshirt? Any pain when I push there?
No.
Okay. Alright, next I'm just gonna have you walk to the door.
Okay.
And then back to me.
Will you stand up for me and then?
And then we'll do that one more time. I'm just gonna stand from the side. Just walk back to the door. And then back to the table. Any pain reproduced with that?
No.
Nothing. Next we're going to do some functional tasks. So if you can stand up here, we're just going to come up on our toes. We're going to take a few steps forward. Any pain with that?
No.
All right, and then turn around, come back down to your feet. Yep. And then come up on your heels and walk forward. Any pain with that?
No. But I'm
Stiff? Where do you feel the stiffness?
I don't.
In your back when you do that?
Let me know if this makes sense.
Let me just. Alright, next we're going to do stand on one leg. Pain with that?
No pain.
Can you stand on your right leg?
Yep.
Any pain? Pain with that one?
No pain.
Oh, perfect. Alright, can I see you do a squat? Just up. Any pain with that?
No, but that right there, like, that's where I just have to be careful. Like when I'm very careful on how I go up. I definitely don't go down and up like I used to. that makes sense.
Is there any pain?
There's no pain.
Can I see
No,
you do
there's
it
no
facing me? I just want to see
Sure,
if you
sure,
kind
sure.
of favor one side. Okay,
Sure, I probably
just a
do.
little bit.
I probably do.
Kind of favor the right
Yeah.
a little bit more.
Yeah, because I feel
Which
like
is-
my left side is
It's
weaker than
consistent.
my right.
Yeah, consistent with what you're telling
Yeah.
us. All right, I'm gonna have you sit on the corner of this table. Right behind. You can face friends here. I'm gonna have you act like you're putting on a sock or a shoe. Yep. Okay, and then can you pain with that?
No, but I can feel it. Definitely.
It's like
tight.
tension, it's
oh, yeah,
stretching, okay.
Definitely, definitely.
And then let's do the right
And,
side too.
and this will be too, but more. Yeah. Now I will tell you, like when I get up, let's say I have to do put my socks on. A lot of times I'll do this, and I'll just kind of go
Okay.
push myself back up.
Yeah.
If that makes sense.
And then can you touch your leg over?
Yeah, I can do that. And
Any-
I don't have any.
nothing? And then how about the other one? Yeah.
No.
Let me just check my notes and see if there's anything else. Let's do a quick, we'll do a quick hop
Okay.
and just see if that gets us any encourage. Just like hop forward. Anything with that?
No, no pain.
Okay. All right, and then the last thing, I'm gonna have you sit down one more time, face the computer right here.
Okay.
I'm gonna have you cross your arms over your chest. I'm just gonna pull up on you, just to relieve any pressure in your back.
Okay.
Actually, can you squeeze the pillow?
Yeah. That.
Yeah,
Hug the
just like
pillow?
that, hug the pillow. I'm just gonna pull like that, okay?
Uh-huh.
Any change in symptoms?
No, not really.
Any
No.
relief?
No.
And then,
If anything, I was probably hesitant, just like, you know.
oh, when I was pulling up?
Yeah, like I just, you know, I didn't feel any pain, but I was expecting to. If that makes sense.
Oh, okay,
like,
yes,
You
it
know, like
does.
you're kind of hesitant.
Yeah, there's a little fear maybe.
Yeah, a little fear.
Okay.
Yes, that's good.
And then I'm just gonna do the opposite motion, so I'm
Okay.
just gonna push down.
So it's the same thing. I'm sort of like, still feel like.
Just let me know if you feel anything.
I actually do feel a little tension.
You do? Okay.
Just a little tension. Yep.
We will make a note of that as well. And then we're going to move on to some range of motion testing.
So hi, I'm Rayleigh. Hi. I'm another one of our physical therapists here. And I'm just going to continue your exam by looking at how you move and doing some active range of motion is what we call it. So to start, could you come and just like face this way, the camera, you can come stand next to me. I'm going to show you each of the motions that we're going to go through. So the first one, can I see you just bend down and touch your toes and come back up? And if you can't go all the way, that's fine. Okay, up. And then can you go into that again? And I'm just going to apply a little bit of pressure at the end range. Okay, and you can come back up. Now can you put your hands here and just extend up to the ceiling? And let me know if there's pain with any of these as well. You can come out of it. And then we're going to go back into it again, and I'm going to add a little bit of progression at the end range. Okay, can you come out of it? Next, you can take your hand and just slide it down your thigh and kind of side bend as far as you can. And then you can come up out of it, and then go back down into that motion. And same thing, I'm going to add some end range.
Oh yeah, I can feel it.
There's pain there.
There's just discomfort. It's not really pain.
Okay, you can come out of it. And then we're going to do it on the other side too. Is there pain when you're actively doing it, or just when I was adding the
Just
pressure?
when you were adding the pressure.
Okay, and you can come out of it and then go into it again, and I'm going to add the pressure. Is there pain on that side?
Just discomfort.
Okay. And now can you sit on the corner of this table for me? And this time I'm just going to be looking at your rotation, so I want you to cross your arms across your chest, and then we're just going to turn towards that wall as far as you can go. And then I'm just going to add a little bit of overpressure again. Any pain with that?
No.
Okay, and then you can turn and go this way.
Just discomfort. Yeah.
Okay. Next, you can scoot over here just a little bit. I'm going to test some of your strength. So specifically, I'm gonna be looking at your hip and your knee and your foot, just because a lot of those work really closely with the low back. So we want to make sure everything is okay there. Okay, so I'm just going to sit on this stool to start. start, could you lift your hip up for me? Just like as far as you can. Great. And then you can bring it down a little bit. I'm gonna push it down. Don't let me win, okay? I'll count you down from 3. So 3, 2, 1. We're gonna hold it. Hold, 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 hold. Great. And we're gonna do the same thing over here. So you can come up into my hand. And I'm gonna push down. 3, 2, 1. Hold, 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 hold. Okay. Next, with your knee, I want you to kick out into my hand. And same thing, we're gonna hold it for 5 seconds and don't let me push you in, okay? So,
I'm gonna do what?
you're gonna push, I'm gonna push it. So, you go ahead and push into my hand. 3, 2, 1. Hold, 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 hold. Great. We're gonna do it on this side.
Okay, so this is where I do feel like weaker on this side. I don't know if you can feel it.
Yeah.
But okay. I was just wondering because it's so.
You're coming. Hold, hold,
Yeah.
hold, hold. Okay. And then next, don't let me, I'm gonna pull you, don't let me pull you out, okay? So 3, 2, 1. Hold, 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 hold. And then don't let me pull you out. So go into my hand. 3, 2, 1. Okay. Hold, 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 hold. Great. And then can I see you point your foot up? Like toes to the sky. Great. Don't let me push your foot down, okay? 3, 2, 1. Hold, 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 hold. And then same thing over here. Don't let me push your foot down. 3, 2, 1. Hold, 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 hold. Okay. Great. So that looks pretty good. So I'm gonna do one more test looking at the strength of your muscles. So could you lay down on your stomach at this end? And what I want you to do, I'm going to be looking at your glute strength. So could you kick your leg up into my hand? Like your whole, yep. And then you can stay into my hand and I'm going to push down just like we did a second ago. So I can count you down again. 3, 2, 1. You can come into my hand and then hold, 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 hold. Great. And then I'm going to come around to this side. We're going to do the same thing. So you can kick this one up into my hand. 3, 2, 1, and hold, 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 hold. Okay, great. So next, I am going to, I know I just watched how you like actively move, but now I'm gonna move you and just see if you have some more motion when I'm doing it. So I'm gonna put this pillow here, and if you could lay down with your head here at this end, that would be great. On your back. On your back. I'm gonna raise you up a little bit as well. Okay, never mind. Can I flip you and have your head at this end?
Oh, okay.
That'd be easier to see.
Yeah, just because this is the head of it. Okay. Okay. And yeah, I'm just gonna be passively moving you myself. If anything reproduces any of your symptoms or causes pain, just let me know. Okay. Okay. So I'm gonna start on this side. You can just relax and just let me move you.
So if I feel pain, do you want me to say something?
Yeah, just tell me if you feel pain. And yeah, just
Just tight.
not too bad.
Alright, you can sit.
Any pain?
It's just that part. So what is that? That's your strength. I'm trying to relax. Just sitting. Okay. Hands are cold.
Sorry. You can tell it's warm up. Okay, so your motion's pretty good and it checks out with your strength. You are really strong. Your left side is a little weaker, like you were saying, but it's not like a huge discrepancy. But we can do some things to help that. Okay, so next, could I have you lay on your side towards me, facing me? And if you could scoot down on the table a little bit, I'm gonna assess, I'm gonna do some of these same motions and I'm just gonna feel your spine while I do them and come down even a little bit more. That's okay. Just so your feet are a little bit off the table. Okay, and so again, I'm just gonna move you, you just relax. So, to start.
You want me to tell you about your pain though? Do we
I'm just gonna do the same motion.
Yes.
I might need help with these, y'all.
It's okay.
Yeah. You can just relax this leg.
Okay.
You don't have to do anything. I'm gonna
Sorry.
hold this. No, it's okay. And again, just let me know if there's any pain or anything. Okay, great. And then is there any pain with that?
No.
And then could you scoot down just a little bit more? Sorry. Okay. Is there any pain going back?
No, but it's tense. I mean, or yeah, it's stiff.
Okay,
I can feel that.
great. Gonna check your rotation at your low back as well. And is there any pain when I do that? Or tension or anything? Okay, great. All right, now you can sit up.
Okay.
And we are gonna move on to the next part of our exam.
Hi, I'm Kayla Owen. I'm a physical therapist. I'm going to work with you today, and we're going to start off with a sensation test just to make sure everything's good there. So I'm going to start off with sitting in, and we're going to be focusing on your legs, and I want you to have my hands on you, so I want you to let me know if you feel it or not.
Okay.
So I'll be close your eyes. Okay. Feel that?
Yes.
Okay.
Yes.
Did you feel that?
Yes.
Okay. Feel that?
Yes.
Okay, great. So now I'm going to come in again and move your arms out of the way and do that one more time, but in different spots.
Okay. Yes. 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 Yes.
And then when I open your eyes, and I am going to have you take off your shoes because there's some on your feet. I just want to
You have to take the socks off.
no. Again, your face.
Yes. 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 Yes.
Okay, great. Okay, so now I am gonna come in and test your reflexes.
Okay.
So I'm gonna grab my hammer. You just lift and I'll just be testing your knee reflexes and then your ankle reflexes. Have you done this one before? And I'm trying to scare you.
It's okay. I don't know if I've ever done the ankle one.
Okay. Okay. And then we are going to do a test now that we're putting tension on your nerve back here just to see if that's involved in your symptoms and what's going on with you. So I'm going to have you, I'll explain this test to you first, but I'm going to have you lay down on your back and I will grab your leg and be lifting it up and then we'll see if that makes your symptoms worse or better. Okay. So I'll have you go ahead and lay down. Yeah. And then which side do you say is affected a little more? You said it's about the same.
It's the same.
Okay.
So, but I mean, like for weakness and stuff, my left side.
Okay. I'll just start with the right side then.
Just bend backwards, the upside, and then try to rotate it.
Okay. You can relax. Are you feeling any
Back. Side.
symptoms or anything?
No.
Okay.
Good right there.
I'm gonna have you also bring your ankle forward. Does that change your symptoms at all?
No.
Okay, and then I'll have you lift up your head. Okay, and come back down. Did that change any of your symptoms?
No, but I definitely, I mean, I was shaking more through there.
Yeah.
Probably because I'm weak.
No. Okay, and I'll do the same thing on the other side. Okay. Lift your leg, relax, I can carry it for you. Okay, anything there?
No.
Okay, gonna bring your ankle forward. Anything?
No.
And then I'll have you bring your head up just to see if it changes any symptoms. No difference? Okay. We'll come back down. You good?
Yeah.
Okay. So that's all for that one. And then you can sit back up. We're going to be doing an endurance test now just to see look at kind of the endurance of one of your muscles. Your multificus muscle, which is like the back muscle back here. So for this, I'll go ahead and explain it to you before I have you do it. You're going to be in quadruped position, like on all fours. And I'm going to be feeling on your back structures here because I want to feel for this muscle activation. And this is us if you're on the ground. But you'll lift your leg up and then your alternating arm up, and I'll feel for that muscle. But we'll do both sides. So you want to go ahead?
We do it on here.
You can do it on here. It's
Okay.
I might move
This is
down
where
a
I'm
little
old
bit.
and I have to really concentrate. Okay?
No, you're good. I'm gonna move this down a little bit just so I'm shorter. So I just letting you know. So
No,
you're
that's fine. Here, you want to do that first?
Yeah. I don't know if it'd be weird to be moving while there. Okay, so that should be good.
Okay. All right. Which side do you want to do first?
Let me go ahead and find where I want to. Okay. So for this, you can lift your left arm and your right leg. Okay, we'll come back.
Okay, now I can feel tension right there.
Okay. Okay.
The other side.
Was it pain or was it just like a tension?
It was tension.
Okay.
But it had a little
Okay.
bit of pain. Yeah.
And I'm gonna come over here on this side, so I'm not in your way.
Okay.
Okay, same thing. Go again.
But the other side?
Yes, with the other side. Okay, you can come back. How was that one?
That one did not have any.
Okay. Gotcha. Okay, well, you're good. You can come back and sit down. And we're just, sounds scary. We're looking at the stability of your spine just to see how the muscles and the ligaments act. So I'm actually going to raise this table back up. Okay. So I'll demonstrate this exercise or this test to you.
Okay.
So can you show me where like the most painful part of your back is? Like just put your finger on it.
Very bottom.
Okay. Like here?
Yep.
Okay. Gotcha. Okay, so for this test, I'm gonna raise this table up a little more. So for this test, I'm trying to adjust it to your height too. I think this will be good for about the same thing. You'll be leaning over the table.
Okay.
Man, I'm still not kind of. Okay. So you'll lean over the table like this,
Okay.
and I'm gonna put my hand on the place that's the most painful.
Okay.
And when you lift your legs up, we want to see how it changes your symptoms. If it makes you
I'm gonna lift my legs up from the floor.
Yes. So I'll show you. It's kind of like this.
Okay, we'll do this.
This is the last test you'll
Yep.
do me.
No, it's fine.
Okay, come back down. How does that feel?
I don't like doing that.
Okay.
Like, you know, I can do it, but I probably could only do that a handful of times.
Okay.
At two.
Sounds good.
'Cause it would definitely, I would start to be like, okay, I feel weird.
So yeah, you can just lay down, and I'm gonna put pressure here,
Okay.
and then whenever you're ready, I want you to lift up your legs.
Wow, okay, let's see. This is where I gotta get my mind right, because I don't know how to
You can do one leg if you want to.
I'm gonna try both.
Okay. Yeah.
I don't know.
Okay. Good.
I can do it, but
No, that was fine. Yeah. Did it feel better when my hand placement was there? or less?
that's a good question. I probably probably.
I don't want to make you do it again.
No, I don't mind. It was probably, I probably felt easier because you were there to
Stabilize.
support. Yeah, like I have not done anything like that before.
Okay. Okay.
Like I don't know if I could do that, but I did.
You did, yeah.
Yeah.
Okay. Well,
If that makes sense.
it does make sense. That's all for me.
Hey, how you doing? My name is Kristen. I'm the student physical therapist that we work with today. So what I want to do is I want to go in now and I want to feel around the spinal segment in your lower back, just to see how much motion we have in that region. I want to see if we have any hypermobility or hypomobility, just to see how we're looking at it. Okay. What I'm going to have you do is I'm going to have you lay face down, and I'm just going to roll up your shirt, just so I can feel around those segments. Is that okay?
Yes.
Yep, so you can put your head in the face forward. So basically what you're gonna feel are some gradual presses from my hands.
Okay.
And I'm just gonna start in the center and then I'll branch out a little bit, and I want you to let me know if you have any pain in any region that I am testing, okay?
Okay.
I'm just gonna roll this up. Roll this up. Let me know if my hands are too cold as well,
Okay,
because
you're
sometimes
fine. You're fine.
All right. Let me know if you have any pain with any of these.
Okay.
You doing okay so far?
Yep. So far, I feel tension there. but
Tension?
Not like, I mean, I'm not like in crazy pain, but I can definitely feel a difference.
Okay. Just let me know as I'm going down.
Yeah, as far as when you're going down. Yeah.
How about
Yeah,
now?
I can definitely feel that.
Okay, I'm going down one more segment.
Okay.
Anything
Yeah,
there?
that's the point where I think I feel the most pain.
That's the jackpot right there? Okay. So what I'm going to do now, I'm going to start back up here. Can I see your thumb on your hand right there? There you go. Just for reference. Alright, now I'm going to branch out a little bit. It's the same thing, just let me know if you feel any pain in any other areas that I'm testing, okay?
Okay.
Anything there?
No, I can feel a little bit of tension, but no,
Okay.
not really anything bad. Or,
One more second. What about in here?
I can feel tension. But
Okay.
not,
I'm gonna check the other side. I'm gonna spots back up. I see your thumb one more time. Any pain?
I'm okay. But yeah,
Okay.
I see what you're doing.
segment. Anything there?
I can feel tension.
Okay. I'm gonna go back to in the beginning when I was feeling right in the center, and I want you to let me know was that pain at the beginning of my push or towards the end, okay?
Okay. Yep. It's towards the end.
Towards the end? Okay. You can sit back on up here.
Okay.
Okay, so based on my assessment, I saw that we had some stiffness back there in the low back, specifically looking at the L5 segment. What I want to do now is provide treatment, some mobilizations with more purposeful push that I was doing. And this should hopefully help allow some motion in that region as well as decrease some pain that you may be having, okay?
Okay.
So you can lay back down again.
Okay.
So I'm just going to roll this back up. And just to give you an idea, we're gonna do 4 rounds at 60 seconds, okay?
Okay.
Doing okay?
Yep, but that is the exact spot where I get most of my tension or pain.
We're gonna try to knock it out, okay?
Okay.
Rest.
Okay.
You doing okay still?
Yeah, I actually like that. Heck. Yeah.
I can
Like,
do that to you at home.
You can?
Yeah.
I mean, it's like I want to have like a little machine or something that could just, I could plug it right in and just, you can do that on your back. Holy moly.
All right, round 2.
Both side pain or both side feel
Right. Can you go ahead and stand up for me? So I know that earlier when we were doing that extension motion, you had some issues. I want to try that again, okay? So put both of your hands right here and roll back. And we're going to extend back. Come on back up. Compared to earlier, how did
I
you
definitely went back a little bit further.
the pain-wise?
Come home.
Pain-wise, how are you feeling?
I'm fine. Yeah. Well, I mean, right now it's loose. Yeah. So it's, yeah.
While I let my colleague take over for the next portion of the assessment, we'll give you some exercises to take home.
All right, for the next thing, we do want to see how you deadlift.
Okay.
So if you can just use your imagination and kind of role play for a second. We just want to see your body mechanics and make sure you're doing the deadlift correctly. If you can face, you can come actually right in the middle.
Yeah.
So you have enough space.
So I usually deadlift with like 25s or 30s
Okay.
dumbbells. So I'll be like,
Any pain with that?
Like I can pretty much like swivel my back to where
Yeah.
I can get it to hit right.
Yeah.
If that makes any sense.
Yeah, it does look like you're kind of like hinging over
I
a little
hope
bit.
not. Okay, yeah.
So we want to like keep your back straight. Try to keep the
I probably need to look in
a
a mirror a
neutral
little
back.
more.
Yeah. But we can work on your form with this
Okay.
as well. But yeah, well, let's go ahead and get into like the home exercises that we can
Okay.
give you. We can demonstrate.
Yeah, I would love some more lower back exercises or whatever.
All right, we'll give you some of those. The first thing I want to teach you is a way to get up off the floor
Okay.
without like, you know, straining or kind of climbing. So if you're sitting down like rapid presence, you know, for
Yep.
20 minutes, you're like, okay, my
So
back
maybe
is kind of
one-
hurting. Instead of, you know, getting up like this, maybe you can come all the way to all fours, then come up to a tall kneeling,
Okay.
and then half kneeling, and then push through.
Okay.
And that's one way to get off the floor without, you know, putting so much strain on your body.
Right.
And so, if you want to demonstrate
Okay,
that,
you try?
yeah, I'll do it with you.
Okay. Yeah. Okay. So let's
So
say
we're-
we're.
Yep.
Okay.
And then come over to all fours, and then come up to.
You want me more to put.
Yep, and push
just
through.
There.
Does that feel better doing that?
I can practice it and see.
It might take a
It may a
moment,
little
but
bit,
it'll
yeah.
relieve some of the pain. Hopefully,
Yeah.
when you're
With
coming
the
off
pressure on the
ground.
back.
Yep. Okay. The next one is similar to one of the tests we did, but we're going to be on all fours again. This is going to be good for your glutes and your back muscles.
Okay.
And so instead of doing the arm and the
Uh-huh.
opposite leg, let's just do the leg first. Kick straight out, then come back down. Kick out again. And we're going to do 3 sets of 10 on each
Okay.
side with those.
Okay.
And we'll do that like 3 times a week.
Okay.
Any pain with that?
No.
With this? Can I watch you do
And
a
it's
couple
definitely
more?
much easier if I just do one.
Yeah. Okay, perfect. Try to keep it back. That's
So
how
am
it is.
am I moving my back a little bit?
Yes. I mean, you were kind of rotating,
Yeah.
but we want to try to keep our hips nice and parallel with the floor. Does that feel okay?
Yeah. I have to concentrate though. So I'll rotate.
Okay. So since compression kind of aggravated our symptoms, something to offload the spine, you could use like a chair and a countertop or something. You can kind of just like sink into it, offload the lower back, kind of put the weight through your hands.
Okay.
You would want something that's probably the same
Yeah.
height. 'Cause I'm a little.
I'm trying to think where I can do that. I was gonna say, I'll get you counter.
If you could, yeah, if the counter's high, you can go your elbows. You know, something just to like offload your back for a moment. You can try that. There's one more. Oh, yeah. And then the last one would be using a chair, and like if you don't have a stability ball, you can use like your bed, and this is just to help with pain, like offloading the spine again. You can really pull it out, stretch, put this way to the end, and in those directions.
Okay.
So
Yeah.
if you want to try either
we
one of
try.
those.
We do have an exercise problem.
Feel a good stretch there.
Yeah, I do actually. That's good.
And you can hold it
I think
out
I
there for a
could do,
second
yeah,
too.
this would be,
And just slow control.
yeah, I actually like this one.
And so these you can do like a lot more. You can do, you know, 3 sets of 15. You can do these like almost 4 or 5 times
Yeah.
a week.
Yeah. No, I like that a lot. I'm like, okay.
You have that little.
But those 2 should be good for symptom relief.